homeopathy is such a powerful tool. So
It
today
is.
it is Dr. Pitcairn is here today to bless us with his knowledge. Dr. Pitcairn was born in Los Angeles, woo woo, and ended up traveling between Southern California and Oregon, it looks like, for a lot of your career. And you were a PhD in immunology. Is that correct? And you're
Yeah, viruses and immunology. Yeah.
amazing.
Yeah,
You
it was.
you also have written a few books,
One book, four editions.
4 editions with different color covers,
My
and
wife did the cover on the last edition.
that's so sweet.
She painted it. Yeah.
And then you also have your school.
Yeah, we have a training program for veterinarians to do homeopathy.
And I truly believe that you brought homeopathy to the United States animal veterinarian community. And thank you
Mm.
for being here with us today.
Oh, thank you.
So tell us, how'd you get involved? How'd you go from conventional UC Davis to natural?
Well, it's kind of a strange story, I guess. I was a fair, I was a reasonably good student as far as getting grades and studying. And uh, and yet, when I went into practice after getting out of veterinary school, that was in California. That's where I went to school. And got a practice in Southern California. I went to a practice in Southern California, and I just felt like I wasn't satisfied. I did what I was taught as far as giving treatments, and I felt like the animals would respond, and I see symptoms sometimes diminish or go away, but they didn't seem very happy or healthy. It was my impression. And I was disappointed in that, I think is what it was. So I started looking around trying to, actually the next step was getting the PhD because after a couple of years, I had assumed, I mean, I'm a typical guy, in the sense that I figured there was something wrong with me. I
Why?
didn't I didn't know enough. I didn't understand enough. So I had an opportunity to join the veterinary school in Washington. And I joined the faculty and I taught for a year there. I taught epidemiology, study of epidemics and public health. And then after a year, I had the opportunity to start a PhD program, which I did for 6 years. And that's when I studied the immune system and viruses, which was absolutely amazing. We didn't learn much about it, and doctors in medical school really don't learn very much about it, a little bit, but they don't really understand the full mechanism and how it works. It's just absolutely an amazing thing that has developed for us, when you start learning about it. So that was great. But when I came out and back into practice to try to use some of this knowledge, I still wasn't very successful because what I had learned in school, in my PhD, was how things don't work right. I didn't really learn how to make things healthier.
Oh my gosh.
So I
Yeah,
was
because
searching.
everybody was treating the symptoms and the disease expression, but they were not actually understanding the disease. So then you researched how diseases actually worked, but it still wasn't resolving the issue.
I was just looking at I got discouraged. Even after a while, after a few years, I even dropped out for a year and taught physics in a high school. And I took a job eventually in an SPCA doing mostly surgeries. That was in California.
That's
But
amazing.
yeah, I was there 7 years. But I was looking at the just out of curiosity, really. I wasn't thinking of really practicing differently, but I was just looking at different alternatives that were people were had mentioning or were using polarity therapy, color therapy, Chinese medicine, acupuncture, all sorts of different things, And so I came across a book on homeopathy. This is before there was the internet, and it was about treating of dogs with it, and it sort of interested me. for some reason. It was, oh, this is an interesting way of using medicines. I didn't fully understand it, but it seemed kind of interesting. But what really grabbed me then was that I thought I'd try it out a little bit. And I ordered an emergency kit, a homeopathic kit, which has about, I don't know, 35 or 40 remedies in it, common remedies that are most used. And I got the kit, and I had a little book called Boricchi's Materia Medica, if you ever heard of it or remember it.
I
And I
still
had
use
that, and
it.
yeah, so I was starting to learn it a little. Pardon me?
I still use it.
Yeah, yeah, it's good. And so anyway, that was new. I had the kit and I had the book, and my wife and I headed up to Oregon to join my family for Thanksgiving. And on the way, I got the flu, and I got pretty sick. Headache, fever, aches and pains, nausea. So when I got there, I went to bed, kind of miserable, lying in bed, listening to the family laughing and having a good time setting up the table for Thanksgiving. And I thought, well, I should try a homeopathic remedy. So I forced myself to read. It was hard with a headache. I'd bang my head against the couch and that would relieve it for a few minutes. And then um, I read about flu remedies, and I've recognized, I thought, one that fit my pattern, the symptoms, which is dosemium. And I took the remedy, one dose, 30C, and in 20, 30 minutes, I was normal.
Oh my gosh.
I got
Just
up, went in,
that.
joined the family, had dinner, and that really impressed me because it wasn't placebo. I didn't have any confidence in it. So
Amazing.
that impressed me so much that I started to seriously study it.
That would too.
Yeah.
That's just such an immediate result. And what is the chances that you picked the perfect remedy right off the bat?
Well, yes, indeed. So I think I was really supposed to study homeopathy,
That's what
honestly.
I was thinking too. I was like,
Yeah.
this is meant to be.
Yes.
That's so cool.
And so I did, and I studied it. It wasn't easy. I studied it for some years, actually, because I knew nothing about um, the originator of it, Dr. Samuel Hahnemann, 200 years ago. I didn't know about him. I didn't know much about it. I got what books I could find. Um, I learned some methods that I now know weren't really proper homeopathy, but I tried those. So it was a matter of some years of sort of trying to read it and study it and understand it. And eventually, and during that time, I was at the SPCA, and I actually had again, some very dramatic experiences. But just between you and I was treating the staff because I felt sorry
Oh,
for them.
you were treating the office staff?
Yeah, because I was, I'd feel sorry for them. Like one example I give usually is one of the first ones was the woman that worked at the counter, checking in clients with their animals, had an automobile accident on the way to work, a little Volkswagen, and her head hit the windshield and broke the windshield.
Oh my gosh.
And after she went to the emergency, she was treated by doctors. She came back, but what would happen then? She'd be standing there talking to somebody, go unconscious, and fall like a log hitting the floor. And so, after a few days of that, I happened to have a chance to talk to her in the lab room and ask her about it. And she said, the doctor said it wasn't from the head injury. They think it's a tumor. In 2 weeks, I'm scheduled to have the top of my head removed, and they're going to look for a tumor. So I said, would you like to try a remedy? She said yes. And so I studied remedies for head injury, and I gave her one, Nature Muriaticum, one dose of 30C, and she was cured.
Oh my
No
God.
surgery, no surgery, was fine. So that was just one of several like that. So that encouraged me to start using it on the animals, and the staffs completely supported me because I'd had that success with them. And so it kind of grew. And it gradually grew over the years to where then I started doing some house calls. And eventually I decided to open a practice. And that's when I moved to Oregon and opened a homeopathic practice. It did just homeopathy and nutrition, nothing else.
You're kidding me. It's solo,
No.
solo.
Yeah, for almost 20 years.
And
And I
that
was
was
always
in
busy.
the 80s?
I started it, I think, and I think it was, when was it? I want to say about 85, 1985.
And did people think you were crazy?
I don't know. I think I was having confidence in it. And I was feeling, I guess I was sort of driven to do it.
I
When
love
you
that.
look at it from outside, the whole situation, you think, that is kind of crazy. What was he doing?
Here's some little pellets. Well, homeopathy, you mentioned that there's a lot of people that do homeopathy a lot of different ways, and it can be very confusing. That is one of the reasons why I went to homeopathic school, because I had seen some success with it. I didn't know what I was doing. I was winging it literally. And so I thought I better get some education in it,
Yeah,
and then surrounded me with other homeopathic practitioners, and I found out that everybody does it different. Um,
yeah. It's
yeah,
because the understanding of it is not easy. And it's not that it's so complex. It's not complex at all. It's actually very simple. The problem is the ideas that underlie homeopathic practice that Dr. Hahnemann, when he discovered the principles, the basic principles, he worked with it and developed it for 50 years.
amazing.
And when he discovered more and more about it and how it works, which I think are very accurate understandings, they're completely opposite of what we were trained in school.
Right.
That's the difficulty. And that's why people that have used homeopathy often don't accept the full principles of it. It's just too weird for them.
I can understand that. And I've had some cases where I was recommending acute prescribing, and it actually had a healing crisis to it, which
Mm,
unnerved the pet owner. So I
yeah.
always tell everyone healing crises are awesome for homeopaths, but really, really scary for pet owners.
Yes.
What do you do if you see a healing crisis? Are you excited about that, or do you come
Well,
up?
it depends on the situation. What's meant by healing crisis? Well, it oftentimes in homeopathy is called a homeopathic aggravation. And the idea here is that the remedy, the underlying principle of it is that you give a medicine that causes the same kind of symptoms, pretty much. Not absolutely identical, but similar. So, like when I had the flu and I had those symptoms I mentioned, the remedy I took has the ability to produce those same symptoms. And Dr. Hahnemann found out that when he used a remedy that could produce the same symptoms, if the remedy had a stronger effect, it completely pushed away and extinguished the disease. But if the remedy does have a stronger effect, the symptoms may increase for a while. You see?
Is that a good thing or a bad thing?
Yes, that's a good thing, but you don't want, it's unpleasant sometimes to have what's called an aggravation. Usually an homeopathic aggravation is a few minutes, maybe a few hours. They don't occur in every case. And part of the learning of how to use homeopathy well is learning how to pick a potency of the remedy that will minimize that effect. A lot of cases that you treat don't have that happen. They just get better.
Right. So in a aggravation, we've talked about it in this group. We've wondered if it was the body not being like a detox pathway being congested, that it was happening too fast within the body, that the it exceeds what the body can handle at that point. So
No, no, no. It's the opposite. The remedy stimulates the body's healing mechanism and stimulates it more strongly, which what we call symptoms. And so that means the energy of the body, what's called a life force, which is a non-physical energy, is very strong. And when the remedy hits it, it responds vigorously, which means that's a good sign.
so when pet owners are very concerned about an aggravation, do you antidote it or do you write it out?
No. Well, I guess it would if it was somehow if it seems serious or it's life-threatening, but they usually don't. It's usually just one, maybe two symptoms. Usually it's one symptom that's aggravated for a short time. So I usually just let it go and they come out of it and start making good progress.
That's awesome.
But
Yes.
you go with the case, you go with what's happening and see, you evaluate it. That's
Thank
part
you.
of the skill is evaluating what's happening.
And it can be nerve-wracking.
Well, at first, but then as you gain confidence, you don't feel that way about it.
And with the potency levels, I've worked with a homeopath for myself, and the recommendation was like a 12C throughout the month. A woman from India. India has great homeopaths.
Uh-huh.
It's amazing. And it was a very productive treatment protocol for me. It really helped me. And
Uh-huh.
and I never think about 12 C's ever. And so a lower potency for a longer term was so effective and it was so mind-blowing for me. But and because I'm an acute prescriber, usually it's a 30C, occasionally it's a 200C, and then chronic going up to those M's, LMs, I just don't even go there. That's not my comfort level. So, can you talk about when or what can we even discuss that? It's so esoteric. It's such a feely thing, homeopathy.
You mean the potency?
Yes,
Well, it helps to explain if I can take a moment to explain what that means.
absolutely.
So Dr. Hahnemann, when he first discovered the idea that I described a moment ago, that if you give a medicine that produces very similar changes in the individual, that it acts to heal, it stimulates the body's healing mechanism. And the remedy isn't like the disease, it passes away and leaves the body without any influences, so it's healthy again. Well, when he started using that method, and in his time, there were a lot of herbs that were used. There were animal products, there was minerals. And so he started out at first giving it in the usual dose. But he found when he did that, sometimes the effect was too strong. You get an aggravation. So he decided to dilute it and give less of it. You see, he's being logical.
Yeah.
So, and he was very much a chemist. He wrote a book on that. And so anyway, he diluted it 1 to 100, and then he would shake it up vigorously to mix it, what's called succussion in homeopathy. And when he did that 1 or 2 times, he found it did work better and it didn't cause so much reaction. But as he went along experimenting with that over some time, in his lifetime, he finally went up as high as doing that 30 times, what's called a 30C. He didn't go any higher than that. And he found as he did that and increased the potency, which is what he called it. Potency means more powerful. He found that the increased potencies did have more effect towards healing. And his theory about was that what we're doing by diluting it and shaking it up vigorously is releasing the energy from the physical substance. And it's the energy that's healing.
I would never realized he never went beyond a 30C.
No, he for whatever reason he chose not to. There were other homeopaths like Boninghausen in his time that went up to 200, and of course later Kent and others went much higher, which is very good. I use very high potencies. And so you
And
can use any potency in a case. You can use low. If you use low, you usually have to repeat it more often, 6C, 12C. If you use a higher potency like 200 up to 10M or CM, very often one dose is good for a matter of weeks or months.
that's amazing to me. And I think that's where it also gets very tricky, acute versus chronic. Can you discuss that for our listeners, what that
I
means?
don't see any difference in prescribing potency between acute and chronic.
So it's taking the case though, acute is, like bumps and bruises or something
Yeah.
accidental happening, some sort of sudden onset,
Mhm.
colds, flus, chronic being maybe
Something
more
toxic, maybe.
autoimmune issue.
Yeah. Well, acute disease is different. Homeopathic understanding of it is acute means uh, I don't know exact dictionary definition, but sort of like it's something that comes on quickly and sudden. And the chronic are conditions that are usually developed gradually over times, maybe over months or years even. And so you can expect then, because the acutes come on like, you say an injury, and there's immediate swelling and redness and pain or whatever, and then there's maybe something toxic and the dog throws up, and has symptoms with that, then the treatment acts in the same way. In an acute condition, You give a remedy, a positive response is within just a minute or two. It's
Right.
very rapid because the condition is rapid, you see? If it's a chronic, then the remedy will act in the same way, but it's slow because it's not the remedy that's acting specifically like a drug. The remedy is stimulating the healing mechanism of the body. How fast is that moving? You see?
That was a light bulb moment for me. So, because the disease was a slow progressive onset, the actual healing is a slow progressive heal.
That's right. And
That's
sometimes there's things to repair, tissues and organs that have been damaged. So that takes time too. And the chief mechanism for healing that does that? Inflammation.
right. Inflammation's everything, isn't it?
Yeah.
So, I see some homeopaths um, do more a suppressive treatment rather than a curative. And maybe it's a situation where it's a damaged trachea or arthritis where it ends up just being life management. I struggle with that sometimes because I kind of am I'm always an optimist. I always want to think that everything can be cured. And maybe everything can't be cured, but I have faith that it can be. So what are your thoughts on that?
Yeah, so I think there are some cases that are not curable in the sense they've been, uh, well, there's kind of two categories. There's cases that have been suppressed by the methods, the conventional method. You see, let me put it like this. From the homeopathic perspective, we see disease as something that's happening on a non-physical energetic level. Dr. Hahnemann tells us that what he calls the life force, this energy, animates the body. The body itself has no intelligence and doesn't do anything. He calls it an instrument. Okay.
Yeah.
So the I got distracted. What were we talking about?
So we were talking suppression versus
Oh,
cure.
suppression. So the what you're treating in homeopathy is the disturbance on that non-physical energetic level. That's what you're addressing. That shows itself as physical symptoms. And you use the physical symptoms to guide you to the remedy to use. All right, so what's different from the conventional view is that we are physical beings, and disease is a physical mechanism. It starts on a physical level. So the treatments that are done with drugs and surgery are removing the effects of the disease. So in homeopathy, it's seen as you're not removing the cause, you're removing the effects. Now, if that's been done several times with the animal, with say surgery or steroids or whatever, then the case becomes suppressed and sometimes incurable because they've suppressed the healing mechanism so much that it can't heal anymore. The other category is ones that have gone so far as to now be basically close to dying, and they don't have the ability anymore to respond. They can respond to the remedy in terms of what we call euthanasia with a remedy so that they die very peacefully, but they don't have the ability to completely heal again.
I've actually done that through and it came in very handy over COVID is multiple clients of mine, their animals were obviously dying. They had an 8 hour wait at the ER. And I just said, try arsenicum 200C. And
I
they
always gave arsenicum 10 m.
10, well, I never play with those M's.
Well,
Yeah.
but they're not dangerous. They're very effective, and sometimes they act very smoothly. You
Well,
shouldn't be afraid of them.
okay. I'm gonna trust you on that. My girlfriend Rachel Jones is the same. She's like, you need to get into those higher remedies. I'm like, I have such good results with low potencies. But the 200 C's on at least 5 cases, let them just go to sleep
Yeah,
peacefully, take their last breath. And
right. It's
the
very
owner,
nice. And
it is a really non-eventful euthanasia.
yeah, it's very nice to be able to do that. So they die at home calmly, often in their sleep.
Yes,
Yeah.
absolutely. Are there other remedies that you use for that?
There are other remedies for euthanasia. Arsenicum is almost always the one that works, but there are some other ones. Tarantula cubensis, which is a poison of the tarantula. There's a few others, but again, that would be more the practitioner that's got more experience and learned more about the different remedies and how they can be used. But arsenicum is usually the one, in my experience,
I've had
almost always.
very good success with all but one, and that's Lee Black's dog, who's actually on this call today. And she
Oh,
was trying to help her dog pass, and that dog did not want to pass.
oh.
But I used a 200 and not a 10M. So
Well, if it was the right remedy, 200 would work.
that's what I figured.
Yeah. So it's probably a different remedy. But
Absolutely.
it's not really, you don't really treat it different. You go by the symptoms. You match the symptoms to the remedy. It's just that the remedy doesn't have the same outcome when you use it because the animal doesn't have the ability to heal anymore. They've gone too far. They've exhausted themselves.
Exactly.
That's the issue.
Yeah, and I don't think death should be feared.
Well, it seems to happen, doesn't it?
It does, but I don't view it as final. I mean, it's painful and it's agony for all involved, but I don't think it's the end.
Some people say that they have near-death experiences, say they see their animals afterwards.
That's so sweet. I expect
Yeah.
to see mine. They might not be always happy with me, but yeah.
Well, what they may say is, "Why did you neuter me?"
Exactly. You could have done your water bowl with fresher water more often. That's my biggest fear. Um, and so there's some products on the market, commercial products on the market that are literally homeopathic remedies, and I see people feed them daily as
Mm,
like a supplement, like joint supplements and things like that. And I'm like, oh, I think that's a really bad idea. And
it's not homeopathy.
it's not, is it? Thank you for
Mm.
saying that. And I've discouraged my clients from doing that, but people believe the label often.
Well, you know the word proving, right?
I do, but let our viewers
That's
know.
it's used in homeopathy to mean how. Well, let me back up. Again, back to Dr. Hahnemann. When he first discovered the idea, he didn't know if it was true or not. And we don't really have time to talk about the experiments he did to come up with the idea, but he had the idea that maybe if a medicine could produce a similar pattern, it somehow would have an effect that was curative. That was his idea. So he decided to explore it. Well, obviously, the next step was he had to know if some substance could produce the same symptoms. He had to test it, right?
Right.
So he began that for some years with colleagues, family, friends, testing substances one at a time, having them take it repeatedly for several days or a week or so, depending on the substance, and to see what effects it had.
I love that
And
he poisoned his friends.
yeah, so people would do that, and there's all this information that was accumulated about what effects these substances have, and the testing was done in healthy people, so it wasn't mixed with symptoms from disease. Well, the word that was used in German, he was German, or what became Germany, was before the country of Germany, but I mean, it was that area of the world. And the word he used, Prüfung, which means the test, came across in English as proving. That's
That's
where it
so,
came
I
from.
didn't know that.
That's
That
so that, but it's still used, the proving of the medicine. So when somebody talks about a proving, they mean they're going to test a substance to see what it does in healthy people. Okay.
yes.
Now, if that's the method of knowing how what a substance will do, is by repeating it, what would a homeopathic remedy do that is not curative?
Okay.
The same effect. It could cause problems. In other words, if somebody goes out and buys a formula homeopathic formula and gives it repeatedly, they can cause symptoms in their animal.
And I've heard some homeopaths make blends and tell owners to do it for the rest of their lives. And I'm like, no, because
No,
the symptoms come back.
that's called palliation. Palliation is where you give temporary relief without curing. It's like using aspirin or something.
And
So
it's
that's not
dangerous.
really homeopathy. That's the misuse of it.
Thank you. It's scary to me when I run into cases like that. And
Yeah.
people are so committed to the homeopath or the process that they're scared to quit. Um, I'm like, it will bring the symptoms back. So,
Well, you want the principle, and Dr. Hahnemann says in his major writing that I finally came across after some years, which really transformed me because now I began to understand it. The very first thing he says is that the physician's only duty is to cure the patient.
that's that's it.
That's it. You don't palliate them, you don't suppress them, you don't do anything to disturb them in any other way. You only cure them. That's it.
That's easier said than done.
Yes, but that's our goal.
It
If
is.
you're serious about it and you study homeopathy and you want to do it in a serious way, then you accept that. That is what I have to learn to do is cure. And you can. You can learn to do it. You can learn to cure very much the great majority of your cases. The limitation, why you can't cure some cases, we've already talked about that to some extent, where they're already treated so long or they're so advanced in the disease. But the other limitation is you don't have enough information. Because you see the way it works is, like I said, I had the flu, and if I were to talk to a homeopathic practitioner, I'd say, "Oh, I've got a headache on this side of my head, it's pounding." I get all this detail. If you're working with an animal, you go by what the person with the animal says. This is what I observed. This is what they're doing. These are the symptoms. Eating, not eating, thirsty, not thirsty, all that detail. So if you have that information, now you can match it to a remedy that causes the same kind of disturbance. But
Right.
if you don't have that information, you can't find the remedy. You
And
see?
I've had this discussion with multiple pet homeopaths because if if the owners aren't observant enough, they can't give the accurate answers, and then you're grasping for the right remedy.
hmm The client has to be willing to take responsibility and observe. You tell them that. You say, I have to know the details. And so sometimes if it's a chronic case, you can get them to do that. You can work with them until they start to become more observant. It does work in a lot of cases.
Right. You have to kind of reverse engineer it in a way
hmm
when you
hmm
ask the animal owner and
Yeah.
and
Because
it
see, people have been trained not to pay attention to that stuff. The idea is your animal's sick, you go in and you're looking for a diagnosis, right? The veterinarian's going to be able to tell you what the problem is and not to pay attention to things like what position they want to lie in, what time of night they have the symptom is worse, you
hot or
know,
cold.
yeah, all that stuff. The veterinarian's not in the average veterinarian isn't interested in any of that. So the client starts babbling about it. They're ignored. So, um, that people learn not to pay attention to it and not to talk about it. So when they come to you as a homeopathic practitioner, they have to be retrained. You have to be observant. I have to know the details. Because see, Dr. Hahnemann said diagnosis is a wrong idea. That's not how you decide what to treat. You treat on the basis of what actually is happening.
The expression, the
Yep,
disease
expression of it.
expression.
Forget the name. It doesn't matter.
Absolutely. This is such good
It's different,
information.
isn't it?
I love it. The challenge that I have is explaining to people when to redose because people get so excited that it's working. Human nature is to give more. And I'm like, don't give more. Let
It's
the
not
remedy
human
ride.
nature. That's not human nature. That's
Oh,
how we were conditioned.
that's how we were conditioned. Yeah.
Yeah.
So they get so excited. They just want to put more pellets in them. I'm like, wait, let it ride, let it ride. And
Well, you tell them it's not a drug. And if you give too much, it'll cause symptoms. That's all. Simple.
it's funny because I've given remedies, had great success. The owners like they just want to give more. I'm like, don't give more, just write it out. And then they'll call me back and they said, that remedy worked so good for about a month. And then it just wore off. I'm like, just give it again. And they're like, oh, I'm like,
Yeah, that's the
part of
indication.
it.
When
Yeah.
the progress stop, if necessary, in acute cases, usually one dose is enough. In chronic cases, you have to give more repeated doses over time, sometimes weeks or months, to bring about complete healing. And what you do is when the progress stops, and that's part of what you learn to evaluate, that's when you repeat the remedy. And you often give, if you're using it, the way I do it, the way that, what the method that's usually called classical, which is where you give a dose, say you give it 200, and a month later, you think it's time for another dose, so you give 200 again, and then it come, another month later, now it's time for another dose, you go up to 1M. After two doses, usually you jump to the next potency, and you climb up like that.
When do you know when to change remedies? When do you realize that it's not the right remedy or you could do
When they're
better?
not getting cured,
Yeah.
when their symptoms persist, or when they get new symptoms, and sometimes, you have to wait a while and see what happens. Sometimes you're not sure. Is it an aggravation? And, will it get better? So you give it a few days and see. But if they don't, obviously aren't making progress and they're getting new symptoms, then, then you have to reassess it. Now you didn't see the remedy completely accurately before. Now you take the prior information and add the new information to it. And now you can see the remedy more clearly. So the thing I have a little example I could give you if you
Oh,
want about
please do.
why
Yeah.
not to repeat the remedies too much. Because the idea, as I said earlier, is the remedy acts. You see if a disease comes along that appears to the individual on the conscious level, they see it as a threat. The energy of that, whatever that is a plant, a virus, an animal, insect, whatever it is perceived as a threat to them, and they react then with a change that results in symptoms. Now, when the remedy's given, it's also seen as a threat, you see, because it's similar, right?
Right.
So now if you're stimulating that individual by giving them the remedy, stimulating him in the sense you're giving them something that's going to result in the same symptoms, maybe a little bit stronger, as I said before. Does that make sense?
Yes.
Okay. And then they start to react to it. And the reaction then is one of now where they begin to heal themselves. Okay. So
Yes.
that's what we want. Why would we disturb it? So the analogy, if you give the remedy again in the middle of that, it just upsets it again. It's another threat.
Oh,
So here's the analogy I use sometimes. Okay. I hope it doesn't offend you.
uh-oh.
Let's say the guy is sitting on the couch watching TV, watching a football game. Let's say he's the life force. It's an analogy, okay?
Okay.
He's the life force. And he's sitting there watching. His wife comes in and says, "Don't forget to take out the trash. You got to take it out tonight." Okay, okay. About 20 minutes later, she comes in. Get the trash. Okay, okay. You know, finally, he goes and game's over. He goes and gets the bag of trash and he's walking to the kitchen. His wife is washing dishes at the sink and doesn't see him. And she says, "And don't forget the trash." And he said, throws it on the floor and says, "Damn, I'm already taking it out." You get the idea?
Yeah.
The
It's
life force is already doing its job. Don't annoy me by trying to stimulate me with more.
got it.
That's how it
That's a good
works.
analogy.
Yeah.
I'm going to ponder that for a while. And it can be such a waiting game that I get a little impatient. So that was good for me to hear that.
Yeah, you have to come to have confidence that the body is healing. The body's natural state is to always heal itself to its maximum. That's what we're born with.
Right.
The only reason it doesn't happen is if something interferes with it. And that can be what we call infectious disease, toxic substances, um, you know,
Stressors in general.
yeah, whatever is somehow affects them in some way. But if they're left alone, the body just naturally heals. It doesn't have to have your help.
Isn't
When
that
you're a
beautiful?
homeopathic practitioner, you're not helping it to heal. You're getting rid of the disease influence and letting it heal.
It's really beautiful.
Yeah.
Um, what about no-sodes? What are your thoughts on that?
Oh, nosodes are for people that don't know that that's the word. I don't know where I'm not sure where it came from, but it was started quite some time ago in homeopathy, and that's where you make a remedy out of a product of the disease. So let's say measles, and you take measles on the skin, a measles lesion, scrape it, put it in a vial, and make a remedy out of it. So a nosode is a remedy made from a disease product. It could be a skin eruption. It could be some kind of discharge, maybe from some part of the body. Could be the alteration of the blood or something. And so that was just an idea that came up, and so it worked with. And they can occasionally have some use. My experience, hardly ever useful.
Really?
And you don't want to give the say if your dog has distemper, you don't want to give the remedy distemperinum, which is the nosode for distemper. It already has distemper. Why would you give it again?
Okay. Yeah,
Right?
I've
You give a
always wondered.
similar. You give a similar, not the same.
Oh, I've heard lots of theories on this, and I know people that use no-sodes for treatment. And so because of that, I tried it, but I don't think I had good results.
No,
Um,
you
yeah.
can make them worse with it too. I mean, sometimes it can act, but most of the time it either doesn't do much um, or it can cause an aggravation without cure.
I have I
The thing is that the no-sode, again, it's the same principle. When a no-sode is made, like I described, if it's not been made before, it has to be proven, has to be tested. That's the only way you know how it fits.
right.
So
And
if you're just arrogant enough, so to speak, to say, "Oh, I'm going to make a remedy out of this disease and use it," but you've never tested it, you don't know if it fits. You don't have the knowledge.
true. I do use no-sodes on my animals. I had a horse founder to a West Nile shot, and
Hmm.
um titers were really, really expensive back then. They've dropped significantly financially. And so I've implemented no-sodes since 2008, and my horses are really healthy in that regards. I have a favorite story where I was at a boarding facility. Somebody bought a horse, brought it in. Every horse in the boarding facility got sick except for my two. And the owner was like, "What are you doing? Why didn't your horses get sick?" I'm like, "I don't know. I do no-sodes. I don't vaccinate." So,
Well, you can use it no-so preventively. See,
yes,
in other words, let's say the horse is susceptible to some disease that's out there. Because not all horses are. Some are not susceptible, but we won't go into that. That's an interesting path too, but we don't have time to really go into that. But let's say the horse is susceptible and could get the disease, okay? You can give the no-sode ahead of time, and the no-sode then acts and sort of, in a sense, plugs the keyhole. And now when it's exposed to natural disease, it can't come in.
yeah, I've had great results with it. I've
Yeah.
loved them. Absolutely.
Hmm.
Where do you buy your remedies?
Um, the last few years I've been buying them from Hahnemann Labs in California.
Yay.
There's
Oh,
several.
cool.
Good Boron's good. There's several good pharmacies.
So I used to buy through A to Z Homeopathy, Native Health Remedies, I think, and he closed
Oh,
down
oh,
uh,
is that the one in where is that in
New Mexico.
yeah, he's retired and gone out of business.
I know. And he had these little chia size pellets that were so awesome. And
Yeah.
any of those companies out there, please make tiny pellets again.
Oh, you can get those from Hahnemann Lab. You just ask. Those are number 10 pellets.
They don't offer them in smaller potencies. They offer them in high potencies, I
Oh,
think.
really? They
But
don't
I'll
offer them like a
ask.
6C or a 12C? I thought they
Uh,
did.
I'll ask them.
Yeah, ask them.
That's who I've been ordering from lately.
Oh, well, I'm not certain. Maybe they don't. There's also I'm blanking out. There's an Washington Homeopathic.
Okay.
Um, there's several pharmacies. I can't think of them all, but there are some, in the US, and there's some in Canada and Europe, England.
Yeah.
Sometimes I've ordered sometimes England that you can get higher potencies there sometimes than you can in the US.
They have some different remedies and I've wanted to get them and I was denied shipment and I was
Oh,
surprised by
really?
that.
How
Yeah.
come?
Um, I think I wasn't because I wasn't a human homeopath,
Oh,
or there might have been some debate. So homeopathy, I don't, most of you guys know homeopathy has been under attack on a
for
federal
200 years.
for 200 years since Hahnemann started, since he
It
started
has. It
poisoning
has,
his
seriously.
friends. Isn't that
Yeah.
crazy? And so I remember when they said it was a placebo and they tried to pull it off the shelves about 10 or 15 years ago. And then a few years ago, they said, oh, it's way too powerful to be on the shelf. And I'm like, "Make up your mind." So, how do we protect homeopathy?
If you get let's say you take arsenicum, okay, and arsenic is poisonous,
Right.
right? But if it has been processed as a homeopathic remedy, and I mentioned Dr. Hahnemann do a 1 to 100 dilution was a 1C. C means centesimal. It's a Latin word, I guess, centesimal. So then a 2C, it's been done twice. When you get to 6C, arsenic has been diluted 1 million times. There's no arsenic left in there.
Exactly. It's only
But
energetic.
the FDA will say, oh, it's poisonous, but they don't understand.
Yeah. I watched a TED talk of somebody vilifying homeopathy and it broke my heart. And animals don't know a placebo or anything
No,
like that. If you give a remedy and they react to it, you know it's a viable remedy. But
that's not placebo in an animal. No.
I saw a guy on a TED talk take a whole bottle of cell salts and he was like, I'm fine. Nothing happened to me. I'm like, because you proved it. You're like an approving at that point. Yeah. So
Yeah,
it,
so homeopathy is it's an interesting history. In the U.S., homeopathy was introduced in 1825 by a doctor trained in Germany, Hans Graham, and he started treating other doctors, and they became impressed and started using it and spread. And by the middle 1800s, there were homeopathic hospitals in all the states, and there were schools, homeopathic schools. And then we don't have time to go in detail, but AMA and other organizations got together and basically shut it all down. All the schools closed and hospitals were taken over. That's what happened to it. But homeopathy was growing rapidly and it was so effective. It's all political. It's not really because of its effects, it's political.
right.
Yeah,
I have a theory that they want to control it and remarket it as nanoparticle medicine and charge a lot more
I
money.
don't know.
Yeah.
That wouldn't fit with what Dr. Hahnemann discovered, but you see
Yeah.
that you see the desire that's there. As I said at the beginning, it's hard to understand the principles of homeopathy, and the basic principle is that we're acting non-physically on an energetic level, and people don't like that idea. So even nanoparticle is considered physical. You see why it
Oh,
appeals?
oh, interesting.
That's
Because
what sucks them in.
I always akin homeopathy to Hahnemann stumbling onto nanoparticle medicine,
No,
but it's
nothing to do with
even smaller
nanoparticles.
than that.
Oh yeah. No,
Ah,
that's just wanting to hold on to a physical explanation.
okay, I'm so busted. Thank you for clarifying that. We have a bunch of questions in the chat box. So,
Okay.
um, Angel, do you want to ask your question in person or do you want me to read it? Angel. So she wanted to know about arthritis and nerve pain. Um, and those are kind of chronic
Yes.
conditions. And so what dose, if you have any recommendations for quality of life, this this dog is severe.
Well, just like we've been talking about, it's a chronic condition. It's not acute. Um, to treat it, you have to match a remedy to the detailed symptoms. What joints are affected, when the symptoms are worse, um, you know, the changes in the joint, the appearance, there's just some of the detail that you see arthritis doesn't really tell me anything. So
Yeah,
there's a lot of remedies. There's probably 50, 60 remedies that are possible for arthritis, and the homeopathic practitioner has to narrow it down to the one that fits that particular case. So
and
that's what you do, and then you have to treat it over a period of weeks or months, gradually getting better. And the issue with arthritis oftentimes is it's very, and we don't want to go there either. We don't have time to take that path, but a lot of it comes from vaccination.
insults. Yeah, systemic insults.
Yeah.
Um,
Actually, hers was caused by two CCL repairs.
It was what?
She had two CCL repairs, and I think the pain is more so coming from a nerve issue after the
Uh-huh.
last surgery rather
Well, see,
than
ACL is a
arthritis.
chronic condition. It's not, and so with the treatment that was done with surgery, didn't cure it.
Right.
It
It did
only
not.
covered up the effect for a while.
And
That's what I
I
was
think it
saying
actually made it
earlier.
worse.
You have to take that into account. So the homeopath you need to work with a homeopath that will ask you about what the symptoms were when there was the ACL problem and so on.
Hmm. Mm.
That's the only
Thank
way
you.
you can deal with it.
Okay.
and what about software? Somebody in the chat was asking about rubric software or
Oh,
like a repertory.
you mean a repertory.
Yeah.
But for those that don't know, repertory is a book like an encyclopedia that has the symptoms that are all possible symptoms and the remedies that then are used to treat that symptom. And they're called rubrics, so that particular listing. Um, yes, there's several programs out there that are quite good, and it makes it. I'm sorry, let me cough for a minute. So the nice thing about it is that it's faster. There's a lot of data there, and you can work up what's called a case analysis, where you find the symptoms and combine them together and create a graph and see the remedies that are the best fit. So yeah, they're very useful. I use it regularly.
What's your favorite one? I know people have talked to me about Mac repertory, and then other people have discussed other different platforms. There's quite a
Well,
few of them.
I don't know them all, of course. It would just be the ones I use. I used Mac Repertory for years, and it was taken over by Synergy, and that's what I'm still using. But there's Radar, and there's Complete Dynamic, and several others out there I'm not even familiar with.
And they're more affordable now. I looked into Mac repertory when I first got my certification, and I was just,
Yeah.
oh my gosh, I'm an acute prescriber. I'm not a chronic prescriber. I'm not going to end up this. So yes. Um, and so Connie, I hope that answers your question. And what else, you guys? Anybody else? Somebody was asking, Jenny was asking about 30C versus 200C. If you wanted to give a remedy and you didn't have the 30C, is it okay to give a 200C?
Probably. Again, you have to assess the animal's condition. If it's just sort of average condition, I'd say, sure, that's great. If it's an animal that's had a lot of treatment, it has very little vitality. The way you know they don't have much vitality is they no longer produce many symptoms, but they're very sick.
Interesting.
There's no more healing mechanism.
So can you downgrade a 200C remedy by diluting it and not succussing it?
No.
So if you do a wet dose, it doesn't matter how much water might be in it, it's still going to be a 200C.
That's right. Doesn't
Wow.
matter if it's dry or wet, same
Oh my
effect.
gosh. That's crazy. I always thought you could dilute your remedies down, and you can activate your remedies to a higher potency with succussion
Yes.
on a
But
wet
see, if
dose.
you're thinking in terms of diluting it to have less effect, you're thinking of it like a drug.
Yeah, you're
It's
right.
not a drug.
That's crazy. Any other questions, you guys? I'm like, I have a new perspective today. Charlene made a nice comment. She has a dog with a collapsed trachea, and it has gotten so much better that he rarely coughs, and she stopped using his meds for it because of homeopathy.
Hmm.
So that's encouraging because that's
Yeah.
something that we thought would not be curable.
Oh, yeah. Yeah. Absolutely. That's the thing that's amazing about homeopathy. If we have time, I'll show you a quick little case.
Please do. It's up to you, whatever you're up for.
How much time do we have left?
You can go as long as you want. Everybody's here for it. We don't want to wear you down. You can
I
always
have to have
come
dinner.
back. Yeah,
Are
we
there more questions first?
any other questions? Charlene's asking, really, Charlene, I'm going to tell you he can't give you an answer, but what would you recommend for a person with a choking asthmatic cough brought on by gluten sensitivity, which caused excess congestion? That's a
Yeah,
whole
again, you have
day.
to match the remedy. Yeah.
I'm going to say quit eating gluten, Charlene.
Well, that we can't go there, but that old gluten thing is a myth, you know.
Oh, don't tell me that. It's, do you think it's the glyphosate on the wheat or?
It's probably the thing is when they so often when there are reports like that, when it's been tested, giving bread or wheat or something, it has been treated with Roundup. Yeah. Well,
Yeah,
there was a study, I'll just say quickly, there was a study a doctor did in Australia on this gluten question, and he took 20 people that said they were sensitive and tested wheat with them, but they didn't know what they were eating. It's what's called a single blind. You've heard that term?
yes.
They didn't know what they're getting in the food because he mixed it in. And some of them did react, not serious, but gassiness or discomfort or whatever. And then what he did, which is very interesting, he took the wheat and he divided it up. And by that, I mean he took out the sugar, the protein, which had gluten in it, the fats, the fiber. He divided it all up like that. And then the next study he did, he fed those separate things to them without them knowing what they were getting. You understand what I'm saying?
Yes.
The fat one for maybe a few days, the
Yeah.
protein for a few
So it
days,
literally isolated the ingredient,
isolated,
the phytochemistry of it.
right? And when he did it like that, not one person reacted to the protein.
Interesting.
They only reacted to the sugars in the wheat. And he said the problem was digestion of the sugars.
And do you think because it might be I hear that wheat looks so different nowadays than what it did like 100 years ago,
Uh,
just through selection and breeding that we've bred like an inflammatory product.
I don't know. I don't think it's different that I've seen.
I don't know. I haven't seen 100-year-old wheat.
Anyway, it's a very interesting study where he couldn't get anybody to react to the gluten. So, it needs more study, it needs more research, but people are reacting to it, but he thought it was they were reacting to the complex sugars of wheat. But anyway, it doesn't matter. Let's put that aside.
It's interesting to
Can I
know.
show you this little case?
Yes, please.
This is from a little online presentation we did a short time ago, and it's not my case, but it's impressive, and people can get an idea of what homeopathy can do. Um, so let me share my screen,
And
and I'm going over here to here. Can you see it? Tell me if you
yes,
can.
can totally
Okay.
see it.
So this is a case from this practitioner at the bottom here, Sharon Forster Blue, and she's in Corvallis, Oregon. So she says she was working with this homeless community, and they brought this male cat who had a quote unquote eye problem that had been there for quite some time. It wasn't recent. So it was acute, but it was not a real fast acute. I don't know how to put it exactly. The problem was that the eye was ruptured. The eyeball itself had ruptured so that the inner parts had come out and so on. She got an ophthalmologist to look at it, uh, and it was given a very negative interpretation, saying, basically what veterinarians would say with that kind of a condition is the eye just has to be removed. It can't heal. All right. She saw some notes from our class training program about the remedy Symphytum and how it works very well in eye injuries. She gave one dose of Symphytum 1M. You notice that, Poppy? 1M?
1M and one dose.
He ran away to court females. I saw him 10 days later. It was a remarkable recovery. So let's look at what it looked like when she first saw him.
Oh,
Isn't that terrible?
that's terrible.
So this is the way cat had this for some time. It had been recommended the eye be removed. One dose of Symphytum, 10 days later.
That's crazy. This is why I love homeopathy.
Isn't that amazing?
It's nothing short of a miracle.
It is a miracle. Yeah.
That is insane. That's
Yep.
so exciting.
But that's the kind of thing you start to see when you start learning and using homeopathy. You start to more consistently see those kind of results, and it just blows you away.
So I have a dog with a chronic eye issue. Now I'm going to have to go to the M's.
And it's not so much the potency as the remedy. That's
I
what's the
think
most important.
he responds to some vitamin and he responds to some other ones. I have used I have a habit of saying the remedies wrong. Terebinthiana, I think, or scar tissue, or theocynaminum. And that helped quite a bit because he had scar
Oh,
tissue from
mm,
multiple corneal ulcers. He came
yeah,
to me that way, and that definitely helped too.
yeah.
Yeah, but it's an ongoing issue. He's not fully self-sustained without eye drops every few hours because of dry eye now.
Well, if people are interested, that little case was taken out of this. We did about a year ago, we did an online 3-session, 6 hours of series on how to treat wounds and injuries, which is useful to everybody, not just practitioners. I'll show you. Let me share the screen again. I'll show you. You can buy it if you want. Anybody's interested.
Oh, like a online course?
You go to um, I have them up for sale on Gumroad. You see that
Okay.
word there, Gumroad?
Yeah.
So it's gumroad.com, and then you go in there and you put in the search field treatment of injuries and wounds with homeopathy,
Excellent.
and you can buy it there.
Well, we need to
Download
change that rating to a bunch of stars.
it. I should, yes.
Yeah, we would love that.
Yeah, so that could be nice. People might enjoy seeing that. And it's 6 hours of video on how to use homeopathy for injuries.
Fantastic.
We also have our training program you've asked about for veterinarians. It's been going since '92, and that's for if there are any veterinarians or vet techs that are interested, it's a possibility for them.
Excellent. So it's open to vet techs too.
Yeah, it depends on the situation, but you see, we don't want to train people that are not veterinarians that will try to open a practice. That's where we get into problems with the state boards. But if a vet tech studies it and then works with a veterinarian, that's very useful.
We have several members that are also registered nurses.
Oh yeah.
that use homeopathy? Could they take your course?
Well, perhaps we have occasionally let some nurses do it, but again, we have to have an agreement with them. They will not set up an animal practice.
Oh,
You see,
okay.
we would be if that happened and we trained some people that started an animal practice, the state boards would come down on us and shut us down. You see
I
the problem?
understand. Yeah, no, that's a problem.
So
Yeah, I,
if they're not going to use it in animals, and they could say that and they're honest, it would probably work.
No, the point would be to use it for animals.
Well,
I use it in animals, but I don't I very clearly state at the beginning of my discussion with them that I am not a veterinarian and that I am only there to supplement the veterinarian's wishes.
yeah, that's
So
fine.
I'm adjunctive, I would say.
Yeah, that's fine. But you see, then again, if you were trained in our program, could be considered a threat by the state boards.
Oh, I am considered a threat by the state board, but
No, I mean we
whatever.
would, not just
No,
you.
we never
Oh,
want to
Our
put you in
program.
trouble. Yeah,
yeah.
no, we
Yeah,
don't. There's no way we want to put you in a precarious
we're
situation.
already precarious.
Yeah, exactly. And Connie was asking, do you always use Apis for bee stings, or do you actually take take-
Never use it for bee
You
stings.
never do?
Never.
Because it's like with like, it's too simple.
Yeah, it's the same thing. Why would you give that? You already had a bee sting.
That's so funny.
Well, you could look in the references, the homeopathic. I mentioned the repertory. If you look up the symptoms, stung by a bee, apis is not in there.
Isn't that
It's
funny? And I always wondered about that because it's basically almost like a no-sode at that point that
right.
you could actually overstimulate.
Yeah, it might act sometimes favorably, but it's not reliable, and sometimes it can make it worse.
Amazing.
But
Thank you
the
for
idea is they've
coming.
already had it. See, they already got exposed to apis.
Oh my gosh. Thank you so much, Connie, for asking that. Well, thank you for your time. If people want to hire one of your veterinarian homeopaths, do you have a data bank?
On my website, we have about over 500 that have trained with us. Some of them are really busy in their practices with
All of them
homeopathy,
are.
but there are some that were willing to take referrals, and they're on my website. So if you go to drpitcairn.com, Dr. Pitcairn is one word, Dr. for Dr. Pitcairn with no space,
Okay.
.com, and you go to the up at the top of the window, the tab there, the menu, it says referrals. And you click on referrals and go down, and you can search by state where veterinarians might be in your area, by what state you're in.
Excellent.
Yeah. And then we also have one there listing called health consultants. And there's not very many of them, but there's a few of them that are willing to work with you over the phone or email.
Okay.
So
Great.
that's a good source. And then the other site is pivh.org. PIVH means Pitcairn Institute of Veterinary Homeopathy,
Okay.
pivh.org. And that's where our training program is described. And that also, I think, has some referrals there too. That's run by our director, Dr. Stieg in England.
Okay.
Bobby,
Excellent.
can I ask Dr. P some questions?
Sure. Go ahead. This is Jenny.
You might know me. I interviewed you once upon a time.
What's your name?
Jenny
Jenny
Dean.
Dean.
Oh,
Bobby
yeah,
Cats.
sure. Hi, Jenny.
Hi.
Jenny.
Thank you for doing this with Poppy. I love the two of you together. Very fun.
Thank you.
I was curious if you have a favorite potency. Like, do you always reach for 30C or no?
Well, again, it depends on the case. I would say and also it could depend on what's available. I mean, if somebody calls you and asks for help and you say, oh, you should give this remedy, maybe 30C is all you can get. Go down to natural grocers or some store like that and buy it, see?
Yes.
Otherwise, you have to order it from a pharmacy. But if you're seeing the animal yourself directly and it's an acute problem, it is, 30 would work, 200. I often give a 10M if the animal's in decent condition.
Hmm.
it doesn't really matter that much in an acute problem. Usually a 30 will work just fine, but 10M will act a little faster, a little smoother. A chronic disease, again, it varies. Oftentimes, if it's a chronic case that hasn't had a lot of suppression, in other words, non-curative treatments, whether the non-curative treatment is from an allopathic veterinarian or it's from a homeopath that's suppressing. If that hasn't happened and the animal is coming to you with a chronic condition, I'll often start with a 10M.
Okay.
Thank you for clarifying that.
Yeah.
I don't think I completely understand it, so I don't need to keep you on here either. But
You can
Bobby,
replay it. You can
okay. Well, I was hoping for a hypothetical, but that's okay. We can skip that. The other question that I had was you had mentioned that sometimes if the right potency is picked, then you won't have a homeopathic aggravation. So let's say that you are working with a homeopath, they've told you to give like a 200C dose 1 week apart. If you have a big aggravation after the first one, should you drop to like 30C for the second one or no, continue on with the 200?
No, you don't repeat it. Then that means you're going to have a strong, if it's the right, if the aggravation is really because it's the right remedy, then you don't have to give any more.
Okay,
Just leave it alone, let it heal.
got it. Leave it alone, let it heal. Poppy, we both need to learn that.
I know. I admitted that I couldn't push remedies. Normally, I don't like prescribe. I normally tell everyone write it out until you see a decline. But a lot of owners are like, how often do I give it? I'm like, you gotta watch. It's super feely.
Yes. Yeah.
And it's
Only
very
when the progress has stopped.
excellent.
And sometimes it's, it could be 3 or 4 months later before it stops.
It's so wild.
Yeah. But see, you're removing the influence of the disease and letting the body heal itself. The remedy's not doing anything to make the body heal better. It doesn't act that way.
Right.
It's not acting like a drug.
No,
It's just getting the influence away so the body can be left alone and heal.
and it's strengthening the vital force.
No, it doesn't strengthen it.
No.
No. The vital force, it's not weaker because of the disease. Dr. Hahnemann referred to it as being mistuned. It's been altered in its formation temporarily to produce symptoms. So when you remove the disease influence, it simply goes back to its normal state, which is optimal health. But you haven't increased its energy any.
Okay. Thank you for that because I obviously didn't understand that.
Well, I know it's different ideas. It takes a while. It really helps to read Hahnemann's, it's called the Organon of Medicine.
I was just gonna say I need to read the Organon.
Yeah, read the Organon, get the 6th edition, get the one by Wenda O'Reilly,
Okay.
the editor. And it is not easy at first, as I said, but if you read it, and you think about it, you ponder it, you gradually come to understand it.
Dr. Rachel has always bothered me about that. She's like, Poppy, I read it almost yearly. You should read it. I'm like, I know.
Well, it's very valuable. It really tells you what's going on. So what I'm describing to you comes from that.
Exactly.
So if you begin to understand it, oh, I see. The remedy's acting, in this way, and I didn't understand that before. So that makes it simpler. Now you can interpret properly.
Right on. I appreciate your time so much. And I have learned a lot. I hope all of you have learned a bunch today. And I would love to continue this conversation, hopefully another day, because you are such a gem. Thank
Well,
you.
thank you.
We appreciate your time. Anything else you guys want to say before we go for the day?
I'm going to have to get a bigger hat now.
Can you all say thank you?
All
Thank
right.
you, thank you.
Thank you.
Thank you very much. Very enjoyable conversation.
Yes.
There's some love on Facebook too. So we're still going on Facebook. We'll
All
see
right.
repeat, but
Good.
thank you so much. Have a great week, you guys. I'll see you next week. I don't know who our guest speaker is, but I'll let you know whenever I know. Take care. Thank you, Dr. Pitcairn.
Bye.
Bye.